Join our incredible moms who have mastered the art of balancing motherhood in today's episode of We Time Convo.
My name is Debbie.
This is Liza.
Moms sharing inspiring stories, practical tips, and a few hilarious anecdotes. And it all begins now.
Welcome, everyone, to We Time Convo. We have two of our special guests. I'll have them introduce themselves.
Hi, I'm Marita. I work with Liza at the high school, so I'm a science teacher and a mom.
And I'm Suzanne Bovone. I'm a local OBGYN in San Jose.
Well, thank you both for being here. And we have a very exciting topic about teens going through your menstrual cycle. And if we have time, hitting up pregnancy.
All right. And my first question is, Dr. Bovone, when does this usually start? Because I feel like it's starting earlier and earlier with teens now.
So it is with puberty changes, they are happening. The average is slowly declining. Some of it, I think, is probably linked more with just you have to have a certain body fat in order to have a period. And so that we see with obesity, childhood obesity rising, that I think that has pulled it down a little bit as well. And then possibly there's some connection with our food sources and antibiotics and everything in our food sources. The puberty does have those stages of having, accelerating pubic hair growth, the breast budding, and then eventually having periods. So all of that is kind of on this continuum. Not everyone goes through it, in that potential order. Sometimes there are kind of outliers and stuff, but it's a normal process and can be very stressful for mothers and daughters to go through, but there's a lot of information available to daughters as well as to moms.
I would like to talk about my experience and the difference between when I started my menstrual cycle versus my daughter.
Okay.
So, when I started my menstrual cycle, I was scared because we didn't talk about it. Like nobody talks to you about it and it happens. So I was actually scared when I experienced it. Now, because of this new, information generation, I actually had the conversation with my daughter at a younger age. I started actually my period, I want to say at 9. And so I knew that she had the potential of starting it early as well. And so I actually had a talk with her about it, and I actually prepared her for it because I would always keep like a pad in her backpack just in case. And so it happened during school. Her teacher was aware of it. They contacted me and, she obviously was able to manage it that way. But, the difference of experience between when I had it and when she had it, what is going on, scared, there's blood, and my mom was just more like, oh, it was more a matter of fact, but didn't really explain like what exactly was happening to me. So I don't know if these were experiences that you guys
Sort of the "Are you there, God? It's me, Margaret" kind of experience, right? So same thing. Like it just happened. I had come home from school and it was just me and my dad was in the house. I'm like, I'm not gonna talk to my dad about this. But thankfully I had already known about it, and I don't remember because it's so long ago if my mom had already prepared me or the school that I went to had already told me about it, because they're starting sex education earlier in school. Because I think I was in the 6th grade when we first started talking about sex education, but I know that at the school that our sons went to, they started in 5th grade talking about hormonal changes.
Yeah, I was 12 when I started my period, and I already knew, but I didn't know from my parents. The same thing, my mom, we just didn't talk about it at home. But I knew because my friends were always like, "Did you start your period?" Because that just was a thing, right? Back then, like, "Did you start your period yet?" Like, "Oh, that means you're a woman," kind of thing. So yeah, same thing. I started my period and I was like, okay, that's what it is. Mom had pads for me and I just already knew how to use it. Yeah.
So I can also tell you that when I was growing up, like we knew about pads, but the tampons, my mom was like, "No, you're not using that." So I was probably in my late teens, early 20s when I first used a tampon. And that was a big deal. My mom was just like, no. And in this younger generation, they use it actually more than just the pad. They prefer the tampon. And I obviously I know why, because it's a lot easier and a lot cleaner. You don't have to deal with the mess. But even in this young generation, it's much more common, even just the way you manage, having your period. My daughter uses a tampon, and the funny thing is she brought it up, could she use a tampon? And I'm like, go ahead. Right. And I go, but I don't want to be the one to show you. And I had my niece, who was a teenager, show her because she knew. And I think she was actually more comfortable with my niece showing her how to use it. But and I think part of it is because my mom just never made me feel comfortable with it.
Yeah. So
and you're like totally
I'm like nodding with you because the same thing happened to me. So of course, my mom wasn't home the first time. And then, so I did a pad, and like all my girlfriends, when I got to high school, were like, you should be using a tampon. Cause I was an athlete. I was a runner. Mm-hmm. And it was, and back then, I guess they still are, like, you got itty bitty shorts that you're wearing. And so I was like, the pad was so embarrassing. But my mom was adamant too. And I think it was that whole, associating a tampon with sexual activity. Yeah. And I'm like, no, it's supposed to be for comfort level and my sense of self-security. So when my daughter had her period, I said, well, here's pads. And I said, but you can also use tampons. I actually told her about it because I wish I had known sooner when I was in high school, because I would have avoided a lot of embarrassment and, felt a little bit more secure in myself.
I thought it was the greatest invention.
Right. No. And so I told my daughter about it. But then when she's in college now, but nowadays they're like, they have period panties. And so I said she had, like when she first started, really heavy flow. And I didn't have that growing up. Later on in life I did, but I told her, I said, well, I'll get you all these things to like make her comfortable, because it was, to me, so traumatizing that I was always insecure when I didn't want any boy to talk to me when I was on the period, because, it's like so embarrassing. But I think nowadays girls are more educated, so they're less embarrassed about it. So,
and guys, you cannot flush your tampons. I didn't know that. Until like recently, I've been flushing them, and
are you serious?
Yes, I've just been like, oh, that's why I actually liked tampons like years ago. Is like I could just flush it, and then we clogged our toilet, and like the plumber was like, you are not supposed to flush those. I'm like, no, really? I've been doing this for like 20 years.
Oh, you've just been lucky.
So kids, you can't just wrap them in toilet paper and just throw it away. Right. If you want to clog your stuff, don't do it. But one question, since we're talking about tampons, is the scary thing about it, and I learned in high school, was toxic shock syndrome. So Dr. Bovone, can you tell us how that happens and how to prevent that for teens that are using tampons? Or if it's still a thing?
No, it's toxic. Okay. No, toxic shock syndrome is still a thing. And so we do encourage people to not like sleep in tampons, or to take them out, 4 to 5 hours to make sure you're replacing them. And it's usually, oftentimes people just forget about it. And so it stays in there, and they can get really sick with this, septic, and need to be hospitalized. And so you can get very sick from it. Some of the things that don't cause toxic shock syndrome, but still give a lot of the benefits of tampons, would be things like menstrual cups. Which
I personally love.
Discs as well. Some
I've
of
never
the discs.
tried any of this.
Yeah, so they're usually like silicone, and you have to kind of, I have them in my office, and I when the teens come in, they're always my fun visits, because the mom is usually there, but we do kick the mom out at some point. But I keep the mom in the room when we have the general talk just about like periods and all the products, because it's the teenagers know about all of it. It's the moms who sit there and are like, what is that?
Here, so, like me.
I bring out, I have a couple different brands of the period panties so they can see them and touch them. And then we have the cups, and I have different brands because they are different, but you kind of have to fold them and put them up, near the cervix. And people who use them love them. There's menstrual discs that you could use and throw away, and they're just like a little, like, it looks like a diaphragm, but they're not for birth control. There's the Flex disc company has one that's reusable, and so a lot of young people also are pro environment, which is good. We all should be, but that could be a reason that they like using these products as well, because the cup could last you for a long time.
So wait. So I'm one of those, what? So how do these cups work? I mean, did you insert it and insert it? So
you would
daily?
insert it, and then you could leave it there. I mean, you could leave it there for hours. Yeah. Like the discs, you could leave it for 12 hours. Yeah. You can't have sex with the cup in, but the discs are kind of more flattened, so you can have sex with them in. And you just have to, I haven't used a cup, but you could talk more about like the first time, like taking it in and out could be a challenge. It's like a learning curve, but people eventually get to the point where you could reach up, even like a public bathroom, pour it out, pour out the menstrual blood, probably just wipe it down with toilet paper if you're in a public bathroom, or you rinse it off at home and then put it back in. Yeah. But I don't know, was your experience really easy the first time?
So I talked about this in our hair episode.
Now I remember you mentioning this.
It is a cup and it has a little knob on the bottom, like a little knob that you can easily reach in and pull. So I've actually used the disc and I've used the cup. I personally prefer the cup just because the disc is a little harder to take out. Yeah, you basically just fold it. They do come in different sizes, and I think it depends on if you've already had kids or not. Of course, you want to sterilize it first. So I had it cooking on my stove one time, and my mom was like, "What the hell is that?" And I'm like, "Oh," she's like, "Is that how you're gonna keep cleaning it?" So you do have to sterilize it. You do fold it in, and there's very good instructions. I want to say I use the Cora cup. So you do kind of have to, I did a lot of research with like comfort level and everything. So there are several brands out there. You may want to try a couple to see what's more comfortable for you.
And you can buy this at the store.
You can buy it at the store. Yeah.
Online.
You can get it on Amazon. I got mine at Target. You fold it up and you just insert it in. I love it because I leave it in like pretty much all day during a work day. And when I'm in the shower, I take it out and I just dump it in the drain, rinse it off, wash it with soap. And then when I'm done with my menstrual cycle, that's when I do the sterilization and put it back. I don't feel that it's in there at all. Once it's in, it's in. It does kind of sound a little gross because it does get messy when you clean it out. But I mean, I don't care because it's my stuff, But I personally, I recommend it. I love it. I wish they had it when I started my period. It's just better than tampons for me. And it's not wasteful.
Yep.
I can't clog my toilet with that.
And how's the disc different than the cup?
The disc is more of just like a shallow disc. And so there's one that's like with plastic. That one would be throwing it away. The other one that you could reuse is silicone. It just goes up high, covering the cervix, and it works the same way. The same, like it'll collect the blood, but the one different thing is that you could have sex with it in.
Yeah.
Okay.
And it sits up on your pelvic bone. Like it will. Yeah. And personally, I've actually had sex with it, and I don't recommend it. It was still messy. Maybe I had the wrong one. And my partner was like, I can feel it. That's weird. So, but you can, but it was just, in my experience, it did get messy. Like it didn't keep it all in.
I was just to ask you, it can get messy or
okay.
But you can have sex on your period without anything too.
That's true.
So
well, just a quick side question: can you get pregnant when you're on your period?
It would probably depend on how long, like how frequent your menstrual cycle is. Like if you had that really short menstrual cycle, like a 21-day cycle, and you were ovulating, closer to like the end of your period in a sense. So there's always that possibility. So I don't think. Definitely your fertile window would be, 2 weeks after your period starts, but people who have shorter cycles. So I would always say yes, because we don't want to especially for our teenagers or any woman of any age, to say this should be your birth control of having sex on your period.
Yes. No, I wanted to clarify that one because, there's always the, no, you can't. Yes, you can. No, you can't.
Well, can you get pregnant before you even start your period?
Oh, well, potentially. I mean, it's possible, because what if you were going to start your period,
right,
and then you happen to ovulate and get pregnant? You could also there's within the pre-ejaculate, there's sperm, so you could still get pregnant if you're like, well, he didn't ejaculate inside of me. There's that possibility. So withdrawal is not 100%
either. Yeah.
What are some myths that are surrounding being on your period or starting? Have you had any weird questions, or just being an OBGYN?
I'm trying to think of myths. I always ask the kids or the teens, like if they have questions or things that their friends are telling them, but they seem to know it all. So they don't really ask any questions. And I always ask, if we need to do an exam, because sometimes girls will come in that they don't know how to use a tampon or they can't figure it out. And then they worry, like, am I normal? And the first thing is I'm like, well, you're having a period, so we know that you have a uterus, it's coming out the vagina. But sometimes with the hymen, it may be that there is a blockage and that the menstrual blood will come out, but that they can't use a tampon. Or sometimes there's a connection between the two sides, and a tampon might get larger in the vagina, then they can't pull it out, or it gets wrapped around, or they have difficulty with sex. So I usually ask if we have to do an exam, just going over general terminology and having a mirror if they want to look as well. But I would say a lot of young girls are more comfortable with their bodies than I would say we were growing up.
Yeah.
So my question is, so once, I never took my daughter, she just went to her regular pediatrician. And so once she turned 18, Kaiser said, you need to go get, and so is that the age that a woman should start going to get a pap smear and a pelvic exam, or are you doing pap smears for 16-year-olds?
No, usually I will start pap smears at age 21. There are some societies that will say at age 25. And so usually I won't even do an exam unless it's indicated, like either they're at that age that we're doing a pap smear, but it's always still that discussion with the patient. So if some people aren't comfortable with it, if they're not sexually active, again, we always want to go slow and have consent with patients. So most of the time when we see young girls younger than 18, a lot of times they're coming from their pediatricians for the painful periods, heavy periods, they're missing school or missing out on sports. And so then it opens up that discussion of like, what can we do for your heavy periods? More teens, the diagnosis of endometriosis, comes into that discussion. But it is, we just start talking about all of those things and trying to get them so that they can, be involved in their daily activities and not have their period hindering things.
What is endometriosis?
Endometriosis it's a condition where the lining of the uterus is called the endometrium. And some of those cells will be outside the uterus, whether they're on the ovary, causing an ovarian cyst, or on the bowel or the bladder or the pelvic sidewall. And that tissue gets stimulated every month. So every month, your brain tells your ovaries to basically produce an egg, and that egg will produce hormones to get the lining of the uterus ready for a baby. That's the whole purpose of, having periods. And so this tissue outside of the uterus will also get those signals and kind of like grow and respond, and it can be painful. And many women who have endometriosis will say it took them years to get a diagnosis. And so the gold standard of diagnosing it is with the surgical, to kind of look with our own eyes and to have a biopsy. But we're not asking young girls to like have surgery. But we'll usually bring it up, but say the first thing is let's start with maybe anti-inflammatory medications to help with pain management. And then it opens up that discussion, maybe the birth control pill, which, or an IUD. But a lot of moms, will either prep their daughter. I'll ask them like, did you talk about this before you came in? Or a lot of moms are still, no, she can't be on the pill because that whole, you can't use a tampon, it's going to make you not a virgin. Or you can't be on the pill because that tells them it's okay to have sex. Yeah. And I'm like, we're not using it for that reason. But yes, it is okay to have sex. And one day she will have sex when she's ready. But there's still, I think there's consent of the parents. And oftentimes I try to say, to the young woman, like your mom brought you here. She wants you to see a physician. But I'll point out to the mom that Planned Parenthood is available. Like it's better to kind of like work with what your daughter needs. She's the one who's missing school or missing out on things, and not to say no to some medications that might be helpful, because otherwise your daughter could go to Planned Parenthood, which is fine. I always tell every young woman that comes in about Planned Parenthood, because her parents are bringing her to see me, but not every parent's like that. So males and females, if they ever need any type of care for periods or contraception, sexually transmitted diseases, at Planned Parenthood is available.
And they don't necessarily need their parent to.
They don't need their parent. No. Yeah.
That's great.
Got it.
It's a great resource. For
no,
sure.
it is.
Yeah.
And so, because kids don't know, right? Some kids just don't know because, like you said, there's that myth of don't use a tampon, you won't be a virgin anymore. Don't take the pill because now you're saying okay. Yeah. And a lot of these decisions, it's something from the parent that's not seeing kind of the struggle that sometimes these kids are going through. So Planned Parenthood, kids can go and they don't need their parent to go.
Yeah. I mean, you could take a bus there. Like you don't even need to drive. Yeah. So, because I do tell teens, at that first kind of opening, is that everything they say is confidential. But having said that, if they are going to hurt themselves or someone's hurting them, then I do need to tell someone. And that their parents are bringing them to see me. So your parents pay the bills. Yep. So they might see an office visit, a lab bill. So if we're doing testing for sexually transmitted infections, they might get a call from the pharmacy if they're on birth control. So there is that break in confidentiality just because you're using your parents' insurance. So that's where Planned Parenthood would come in if they didn't want to tell their parents.
No, that's good to know.
Yeah, another question I have is, we obviously know, we've all had our periods, what the normal, symptoms are, like cramps, headaches, increased appetite. Is there something that is not normal that a teen might be experiencing or a young woman might be experiencing that's not normal when they have their period? Is there any warning signs or anything that we should look out for in our? Well,
the first 2 years, the periods could be really irregular. So that's important just to let them know that. I encourage them, because they all have their apps in their iPhones, that there are like the period trackers, and there's many different ones, but just to kind of get in the habit. I think we would like mark on our calendars back in the day, but to get in the habit of writing it down. So hopefully when someone asks you like, when was your last period? Is it regular? You can easily kind of look back. And a lot of young girls have, just painful periods or heavy periods and overflow, and then having accidents, needing to like carry a change of clothes. And so excessive bleeding, we oftentimes might want to like ask a family history of bleeding issues or nosebleeds or gum bleeding. Like, do they have an underlying bleeding disorder, which may be found out at the time of the period? And then just with the painful cramps, it's not common for them to have fibroids or things like that. Endometriosis may be something, I think the late teens on up, that could be something happening, but everyone experiences it differently. And you're right, like with the mood changes, a lot of parents will come in and be like, you have to fix her. We can't deal with these mood things. And it's just like we talked about with menopause, like all these hormones cause a lot of mood changes. And it's just acknowledging that and always trying to ask teens about their sleep. Like, they're not sleeping. They're super stressed with school and all of their activities, and their food habits are not good. So I try to kind of also talk about lifestyle things for them.
Yeah.
You just said something that like dinged in my brain. So you said something about nosebleeds. So when I was younger,
you can use a tampon for those too.
Yeah, I heard that.
That's a good way to use a tampon.
Still don't flush it down the toilet.
Multifunction, and don't flush it.
Yeah. No, because as a child, I suffered a lot of chronic nosebleeds, and my daughter the same thing. And then once I got my period, the nosebleeds started backing off, right? And then now that I'm postmenopausal or in menopause, whatever, like I'm having nosebleeds again, a lot of nosebleeds. And so my daughter's like, she's still getting nosebleeds, but they're less and far between. And you said something about nosebleeds. Is there a connection?
I don't know. That was interesting when you're like, it used to come from my nose and it came from like my uterus.
It's a reverse.
Like reverse. I'm like, I don't know that.
I'm getting in back.
But I think if it was like, you should have like an ENT look up there. But I don't know why it was like stopped when you were having your period. That's interesting.
Yeah. So I don't know. Well, here's my science teacher thinking I know what I'm talking about. But like, to me, nosebleeds happen when there's a difference in pressure, right? If you have really thin lining, right? And so it bursts. So then I'm like, okay, well, maybe when you are in the sort of like giving birth stage of your life, that all the mucus walls are supposed to be really thick to protect things. And so now that I don't need to have those thick linings, maybe all the walls, mucus lining walls, are thinning. And so that's why I'm back to being subjected to nosebleeds again.
Can we do a research on that?
I don't know.
I mean,
is it physics related?
There is some physics involved because of the whole difference in pressure and the strength of the materials. But these are things that I think about. So.
But yeah, I mean, we see more nosebleeds in pregnancies. There's more vascular flow. Do you have like gum bleeding when you brush your teeth?
Yes, but I've been making sure I floss regularly. It's more because of a flossing issue.
One thing I have a question about is, I don't know if you noticed, but they say when all females are always together, like me and my daughter, we have our periods all at the same time. Like, we somehow cycle up when we're like in a group. Like, how is that?
I think I was just reading something from an OBGYN physician who does a lot online. She has a book, Dr. Jennifer Gunter, and she had looked at this issue and she kind of said that was a myth, that people don't, even though we all think that we don't cycle up together. But yeah.
Yeah. Me and Ava have ours cycled up together. It's so strange.
Well, as Marissa was starting, I was ending. So we were like, there was like just a small area of overlap where we would have had been the same. But once because she started later than I did. Yeah. So that whole connection to age, I started at age 11 or 12. My daughter didn't start till like 7th or 8th grade. So.
Okay, guys, you heard it. It's not a women group thing, okay? No. We're not trying. So we heard it from Dr. Bovone. It's a myth.
So the other thing that I wanted to go back to is obviously the different types of ways to manage your menstrual cycle. One thing that popped out through talking to someone, because it wasn't talked about often enough, they didn't realize that they were putting their tampon in probably not the right way because they always felt a discomfort when they did that. And then for some reason, in a particular instance, they put it, I guess, the right way and there was no discomfort. So it was because, again, education of how to use these things. If you're doing a tampon, it's not supposed to be uncomfortable.
Yes. So we'll tell people like a tampon in the right place shouldn't hurt. Similarly, I'll use that example when we do IUDs, and I'll say if the IUD is in the right place, it shouldn't hurt. But yeah, sometimes people don't know whether it's the cardboard applicator or they don't know to like take it out.
Yes.
It's as simple as that. Like you have to take out the applicator. So I usually will have, again, all of these things in the office and we'll open up a tampon and show them how to use it. There's the OB tampons without the applicator. But yeah, it shouldn't, if it's hurting, yeah, definitely to think maybe it's not high enough up there.
Or it's just uncomfortable. Like,
and it's not going to get lost. The other people think like it's going to get lost and I won't be able to get it out. People do come in for like retained tampons. Like they don't realize they might have put 2 in and they only took the 1 out, or they just forget about it and they'll come in for a vaginal odor and I'll ask, do you use tampons? Just so kind of like we're prepared, of what we see when we look. But it's common. Those are like visits where I'm like, I solved the problem. I took out the tampon. Like they're mortified, but I'm like, no, your problem is solved. I love this.
And it's not unusual, I guess, because like you said, people come in mortified. It happens.
Yeah. Probably the other thing that with teens that a lot of them don't know and they're excited to find out is that you don't have to have a period because no one really wants a period. And so we'll go over using the birth control pill. How do you use it continuously? So you'll take your active pills for 3 weeks and then immediately open up a new pack, or you're using the NuvaRing back to back, or you have an IUD that will take away your periods. And the moms are like, that's not healthy. You have to clean yourself out. And I'll say, no, as long as you have you're manipulating it, it's okay not to have a period. And I say, if you came in and you're 23 and you're like, I don't have a period, I'd say, are you pregnant? Do you have a Mirena IUD? Are you purposely using your birth control pills that way? And if the answer is no to all of that, then I say, well, let's figure out what's going on. Is there a polycystic ovarian syndrome? Why aren't you having a period? Or a thyroid issue? But when they find out that they can either use birth control pills or an IUD, they're like, why isn't anyone telling you this? And I'm like, I don't know. It's a great thing to be able to like have a period.
Yeah. So it doesn't do it. So you can just prolong actually ovulation then, is that what you're saying?
Well, but it doesn't, you're not prolonging ovulation.
Oh.
Like you still only have so many eggs and it's not preserving your fertility. Okay. So like, that's the other question we get a lot of, like, I've been on the pill for 10 years in my 20s. I need to go off it because it's probably like ruined my fertility. And I'll say, no, it doesn't push your fertility out longer. It doesn't make it worse. But yes, if you come in and you're 37 and you now want to get pregnant, and you're not getting pregnant, it's not because you use a pill for 10 years. It's probably because you're 37 and that the quality of your eggs has gone down.
Oh, but when you're talking about continually to like open up a new pack so you don't have that week?
Yeah, so you don't have that week. Well, because you don't ovulate on the pill. That's how the pill works.
Okay.
So you're not ovulating on the pill. So even when you take that week off, you don't ovulate. You just have like 7 days. And so we'll tell people to skip that week off. And then if you have breakthrough bleeding, you could stop for 3 to 5 days, never more than 7, because then you might ovulate. So that's why all the pill packs have 7 or less days. Like a lot of them nowadays will have only 4 days of the placebo just because it gives you lighter periods.
Yeah. So my question is, I've had the IUD for many, many, many years. And the first time I've had it, I didn't have a period for a long time. Is it healthy and normal to not have a period for that long?
In that scenario, if you have a hormonal IUD, then that's fine. Yeah. And
it's not like just building up.
No, it shouldn't be building up because the progesterone IUDs will thin the lining of the uterus. So we actually will use those as well for women who are at a higher risk for like uterine cancer, those that will use it for hormone replacement because it's acting as that progesterone to the uterus.
That's good to know.
So many uses for the hormonal IUDs. Yeah.
So for the teens out there, if they have regular periods, if there is bleeding in between periods, then that's something they might want to go talk to their doctor about.
Yeah. Once it's been probably 2+ years after you had your first period, if you're having a lot of spotting in between your periods, that can it's an irritation. So it's probably something to come in to try to find out like what is going on. It gives us an opportunity to talk about, all the different menstrual products, sexual activity, if they're having sex, are they having more bleeding with sex, screening for any vaginal infections and sexually transmitted infections. And a lot of teens, when we talk about are they having sex, they'll just think sex is penetrative sex. And so we have to talk about I always say vaginal, oral, anal. Are there partners who are male or female or both? And so it opens up that whole discussion.
Yeah. And teens out there, I mean, if you are sexually active and you just think that just because you have your period consistently every month that there's no way that you're pregnant, you can still be pregnant and have your
still
periods.
have a period. Yeah.
So I feel like a lot of teens think that, since if they're sexually active, they have their period, like, oh, I'm fine, I'm in the clear. But you can, right, Dr. Bovone, that's happened.
Well, it does happen that people might have really light periods.
Yeah.
Or just think, oh, it's irregular, but I had some light spotting. That was my period. It probably not common to have a heavy flow. And people say, no, I've been having my regular monthly periods. You're like, really?
Yeah.
So, but they can have, you can definitely have spotting in pregnancy.
Yeah. So teens, if you are sexually active and you still have a period,
don't think
that you're not pregnant because you want a bonus baby in the toilet. 9 months.
Plus, if you're sexually active, you should always protect yourself.
Yes,
from STDs.
100%.
Yeah. So all the things we talk about, in terms of helping with periods, like the birth control pill and the IUD and the arm implant, I'll still say that yes, this is contraception, but when you're sexually active, to also use a condom.
And there are male and female
condoms and dental dams for oral sex. And you could use a regular condom and just cutting it open to use as a dental dam if a male is providing oral sex for a female or for two females.
Yeah. Yeah. And just because if you have an IUD or taking birth control, that does not make you safe from STDs at all. Because I've overheard teens saying, I'm like, no.
Well, and any STD that you can acquire vaginally, you can also get orally. So you could have chlamydia in your throat, even with anal sex, HPV, the human papillomavirus, which most of our teens should and are getting vaccinated, but that is a risk factor in anal cancer as well. And so some will think, oh, I can't get pregnant with anal sex, but there's still, STDs that you can get. And we try
for herpes.
Yeah, we try to normalize all of that if that's pleasurable to you and that's what you want, that's fine. Let's just be safe about it.
Yeah. And I heard, what I heard? That you can get herpes in your eyeball. Is that true?
Oh, yes.
Oh my God. Asking for a friend. No, just All right. I think that's all the questions that I personally have.
Same here. I mean, I this was very informative. There's certain things that I just did not know about.
Yeah. I mean, and listeners, we'd love to have Dr. Bovone and Marita back on. So if you have any questions for our, OBGYN, Dr. Bovone here, shoot us an email on Instagram, and then maybe we can have a Q&A.
Oh, that would be fun.
With Dr. Bovone, yeah. And specifically, for teens, but anybody, if you have any more questions.
We could bring our teens on, although my daughter would not come.
That would be such a good idea. So thank you guys so much for joining us.
Thanks for
Marita
having me.
and Dr. Bovone.
Thank you.
Yay! Thank you.